Well, good evening, everyone. This is Greg Kelley, and I am president of SEIU Healthcare Illinois, Indiana, Missouri, and Kansas. And this is our very first Facebook Live conversation. The subject tonight will be the fair tax proposal that our governor has recently introduced in Illinois. And so we're excited to have this conversation. For those of you all who don't know, we're SEIU Healthcare, and we represent about 90,000 home care, nursing home, child care, and hospital workers. And our members work in every corner of the state of Illinois, and they work in Missouri, in Kansas, and Indiana as well. But we're here today to talk a little bit about the fair tax. And I have with me my colleague and sister in the struggle, Jackie Rodríguez. Jackie, could you tell folks who you are and so forth?
Sure. Good evening, everyone. My name is Jackie Rodríguez, and I'm a vice president here at the union. And I've been representing home care and child care workers for the past 15 years. So I'm happy to join you guys tonight.
Now, as you all know, this is a Facebook Live conversation. And so this is live and raw. And we're excited about the conversation that we're going to have. So I'm going to keep an eye out for comments that folks will make or might make or want us to respond to, and hopefully we can make this an interactive experience. Again, this is a live conversation, so look forward to the conversation. And so, again, the subject tonight is fair tax. And for folks who are unclear on what the fair tax proposal is, it is an attempt to fix our state's current income tax structure. It's incredibly important to SEIU and its members. A fair tax on income in the state of Illinois would mean that folks who make less money would pay less in taxes, and families with higher incomes would pay more in taxes. The current bill says, or would say, that 97% of all Illinois families would actually see a reduction in their taxes. Let me repeat that. 97% of Illinois families would see a tax decrease under this plan, including those making up to $250,000 a year. And they would see a tax cut under Governor Pritzker's plan. SEIU healthcare members, as we all know, believe in quality care and quality jobs. And this new tax structure would increase revenue in the state to the tune of about $3.4 billion, which would mean the possibility of better care for home care providers, the ability to provide care for our children through child care services, as well as protect safety net hospitals and our nursing homes. These vital services are things that working people in the state have needed for a long time, and a fair tax structure would help make that more of a reality. If you want more information, everything that we're going to talk about here today about the fair tax will be on our website, and that address is www.seiu.hcil.org/fair tax. And we also want to make you aware of a rally that's taking place down in Springfield on April the 30th, which is next Tuesday in Springfield. And we'd like to have as many SEIU members as possible come down and support this very important effort to provide revenue for our state. Go to our website, again, SEIUHCIL.org/fair tax, and click on the link to RSVP and come on down for the rally on April the 30th. So let's get into it, Jackie. So let me ask you a question. In Illinois, who do you think pays more as a percentage of their income? Millionaires and billionaires or minimum wage workers?
Well, actually, you would think that it's the millionaires, right? But what we've been learning is that actually, when you add up all the taxes, not just income tax, sales tax, it's actually low-income workers that pay a higher percentage than the actual rich, and so obviously that is a big problem, especially when the grand majority of our members are not even middle-class workers, right? We're talking about working-class workers in this union.
Well, we think that Governor Pritzker's plan on a fair tax will help address this problem and will fix it. It's interesting when we talk about taxes in Illinois, um, middle class folks in Illinois often, you know, and understandably complain about taxes. When you talk about property taxes, talk about income taxes, and a number of the other city taxes, and particularly in Chicago, that impact working people. But our income tax for our entire state is pretty unusual. We're one of 9 states in the entire country that has what we call a flat tax, where rich people and working people pay the same rate of taxes for our income taxes. And so the proposal that the governor has made would impact that and change it so that rich people pay more of their income, and working people would pay less of their income towards this.
That's right, and it's about time, and I think that also speaks to Governor Pritzker taking a bold step in order to address this. So I'm glad that we're going to be talking about it tonight.
Yeah, to the point, we're one of 9 states in the entire country that currently has a flat tax. And so it's past time that we really do something about the ways in which working people are impacted by our income taxes in the state and make the wealthy pay their fair share.
That's right. And so one of the things I'd like to share with you, Greg, and our members is that, how changing from a flat tax to a fair tax will address a lot of inequalities. So, for example, we've talked a lot about racial and gender disparities. And this is not going to be news to our members, but I'm going to share with you a couple stats. Women are paid less. Women are paid at least 20% less than men. African American women are paid at 37% less than white men, and then Latinas fare even worse, right? Latinas are paid 45% less than white men. So not news to a lot of our members, but I think it's important that we share this with our folks. How does this happen? It's just really bad old school policies that in reality are sexist and racist, that have kept women behind and obviously impact women and people of color. Governor Pritzker's plan, like Greg, you mentioned, is going to add $3.4 billion per year. And we think that this added revenue will at least be a start in addressing these, racial and gender injustices. Because as we all know, when women, especially people of color, have more money in their pocket, right, we are able to afford childcare. We're able to afford better housing. We're able to get paid at a decent wage. And this means this is how we're able to start gaining wealth and security for our communities. But most importantly, like you said, right, more revenue is going to impact directly the services that our members provide, and these services affect the whole state of Illinois.
One of the big challenges for our country, and for Illinois in particular, is wealth inequality. The tax cuts, the Trump tax cuts from a couple of years ago, have only made that a bigger problem. And so in Illinois, we can hopefully begin to try to undo some of the damage that was done through the Trump tax cuts, as well as through some of the disastrous policies of Bruce Rauner, which helped accumulate even more debt for the state. And so we've got to figure out how to get out of this hole. The proposal that the governor's made is, I think, one step in the right direction. 90s, I have to repeat this number, 97% of Illinois families would actually see a tax decrease under this proposal, including folks who make up to $250,000. Now, on our website, you can actually go and click in how much you make into a calculator, and it'll show you in real time just some real examples of how the tax plan that Governor Pritzker has proposed would impact the wealthy and how it would impact working people in the state. I've got one of the examples that we had from earlier. One of the things we looked at was, for example, a family making $25,000 a year. Under this proposal, if you punching it in on the calculator, we'll actually see a tax cut of $225 under Governor Pritzker's tax rate plan. Now, a millionaire under this plan would actually see their taxes go up an additional $21,435. And so for an average working person, they'll see a decrease. And again, 97% of working families in Illinois will see a decrease in their income tax, whereas the wealthy millionaires and billionaires would obviously see an increase in their taxes, which in the end would mean more revenue for the state so that we can provide home care, child care, save our safety net hospitals, and provide the type of reimbursement necessary for nursing homes.
Yeah, and I just want to add, when we say provide home care and nursing home services, like we're talking about, like there are thousands of seniors, thousands of families that do without, that they should be eligible for these programs, but they're not. And so not only is it about expanding, but it's about barely covering, what eligible families would be eligible to get in the state of Illinois. And I just want to mark what you said, like the disastrous, policies that Ronner implemented, even though Ronner is, a distant memory, but his policies are not. And so, we do have to say hats off to Pritzker for, being a rich person himself and trying to put this out there. Again, this is not the Band-Aid for everything, but it's the right step. And as a union, I'm glad that we're supporting it and educating our members about this, because we're going to be at a rally next week, and we should be able to, be glad that we're making a demand to make this happen.
That's right. One of the toughest subjects to talk about, really, is taxes. No one wants to pay more in taxes. And I think this plan speaks to that. It says working people, 97% of working families in the state could pay less, and that it demands that the wealthier, including people like Governor Pritzker, pay more in taxes, because they understand that in order for the economy to grow, in order for all of us to do better, that the majority of working people in the state have to do better. So again, I would remind folks, this is a live conversation. This is our very first Facebook Live conversation. And so hopefully folks are getting something out of this. We hope to engage members more in the future on subjects that are important. And this is one of the subjects that we've started talking about. But a fair tax rally on Tuesday, April the 30th in Springfield. And we're trying to get as many folks to go down and support this effort as possible. You can go to our website again, where the address is SEIU, HCIL.org/fair tax, and click on the link to RSVP and join us down in Springfield. And so, our members know that, quality care and quality jobs are a necessity in this state, but it takes money, it takes revenue to do it. Our fair tax plan, or the fair tax plan, is one way to getting us closer to making that a reality. So one of the things we would also talk a little bit about is safety net hospitals. We have a lot of members who work in safety net hospitals that are in lower income communities that don't have a lot of jobs or access to health care. But those hospitals are funded through the state in a lot of ways, and so a fair tax structure would help save, literally save, quite a number of these hospitals from closure.
That's right, and it'll also help with their staffing levels, right? I mean, this is an issue that our hospital members are always talking about, and we're going to talk about our nursing home members too, but I think in the healthcare industry, staffing has been a problem. How about we talk about home care?
Yeah, please do.
All right. So home care is where I have a little bit of more expertise, but our members, know year after year when we're going down to lobby day, right? When we're demanding a raise, when we're demanding that home care services get expanded, what is it that our home care members are told? Where's the money? I would love to support you, but we have no money, right? And so we hear this year after year after year. And like you said, this is one way, as a way to put more money on the table, because these services that our members provide are services that our state needs. And we already know that, thousands of seniors go without services. This this fair tax would allow not only for our members to be able to have vacation, because a lot of our folks who are probably listening, if you're a Doors PA, know right now that you don't have paid vacation, and that's unfair, right? This $3.4 billion that this fair tax would create would mean that 100,000 more seniors would be eligible for services. So you could just imagine like how important this is for the state of Illinois. And one thing that we had talked about, right? This is not just the right thing to do, but it is the moral thing to do. And so we want to make sure that our legislators, take action.
Yeah, it's the right thing to do. It's the moral thing to do. And in this moment, it's a necessity. We're at a point where we don't have the revenue in the state to do the things that the state needs to do more of. We have more seniors in our state, and so they need more care. So that costs more money. And so we're clear that it's only going to be through a fair taxation system that we're going to be able to take care of seniors and our children through childcare.
That's right. And another statistic that we want to share with you is for childcare. In the childcare industry, we believe that 100,000 more children would be eligible to receive childcare. And these are not small numbers. Like, we're talking about children all across the state.
Yeah.
So it seems like we may have a guest.
Well,
Greg?
we have one of our amazing members come in. Can you introduce yourself? And you are on Facebook Live. And tell us who you are and where you work. And yeah, we start there.
Sure. Well, first of all, thank you for having me. But my name's Kim Smith. I'm a patient care tech at Northwestern, also the chief steward there. And I also sit on the executive board as the vice chair over health systems. So I am definitely all the way in to help the members as well as everyone else in our community.
So we've been talking tonight. This is, as you know, our very first Facebook Live.
Yes, it is.
And so people get to see us, warts and all, and we have a little bit of a script here.
Let me tuck it in there.
We're just having a conversation because we think that it's important that we have conversations with our members that are about things that are very important. And one of the things that's important right now is making sure that our state has the money that's needed to fund the programs that our members work in, whether it's in nursing homes, home care, child care. But I know you're most familiar with hospitals and safety net hospitals in particular, which rely a lot on state funding. Can you talk a little bit about that?
Well, I definitely agree with that, because that is one thing that I will give SEIU credit for, and it is around educating our members. Realizing that the members are a part of the community and the workforce. So giving us that tool to be able to be aware of what's going on. And so, this is a very big thing. We definitely were in agreement to get JB in office, and he said that he would back us as healthcare providers. So to know that this is something that could be put into place, that would actually set a precedence to say, you know what, I work hard, and I shouldn't have to pay more than what someone who makes what I make biweekly, hourly. That's to me, that is a big handoff to say, you know what, I do understand your struggle, and I realize that this is something that's happening here and now, and it needs to be fixed. It doesn't matter what division people work in. I guess the underlying theme is people need to know that this is something that affects everyone. And so when we talk about busting the myth on hospital workers, people are under the impression that because you work at a hospital, you make all this money, and I'm somewhere living la vida loco. That's not happening, And the sad part is that we've got hospitals that are safety net hospitals who are in our communities that are very low impoverished. And it's a very impoverished community, and they'll make $12 or $13 an hour doing the same kind of work that the same tech makes at Northwestern, making $21 an hour. And so with that being that way, it's so if I don't want to work here because I can actually get to work and not try to live check by check, I got to try to commute over an hour to get somewhere just to make a little more. And it doesn't make sense, So it's when I'm paying my taxes and I'm paying more out in taxes, it's what happens to the people that are making money hand over fist with offshore accounts? So JB took ownership, I feel, in saying, you know what, I'm one of those people and I have that luxury, so I'm willing to pay a little more. And And I think that was something that was awesome, you know, for him to even take ownership to that. And I feel like people need to realize, like, this is something we need to go out and make sure that we cast a vote about.
Yeah. This morning, I was, just an aside, I was watching the news this morning, and they had Melinda Gates, who is, you know, of course, the wife of Bill Gates, who's the richest man in the world.
Right.
And she was on TV and, you know, talking about some initiative she was doing on malaria. But she was asked by the newswoman about taxes directly. And she said, and Melinda Gates said, yes, I believe that rich people like her need to pay more in taxes because they understand that wealth inequality in this country is a destabilizing problem. That in fact, we can't have a country in which, you know, 2 people make what 150 million people earn in wealth. And so the way that you can try to fix those problems is through taxation, because we need more services. As I've said earlier, we have more seniors they're living longer. They need more care. How do we pay for that, right? And one of the other things Melinda Gates made the point, she said, philanthropy is good, right? If you decide you want to give to a Northwestern and get a wing named after you, that's great. But government has a responsibility that's separate from philanthropy, and the way that government is funded is through taxes. And so again, nobody likes taxes, but this is an attempt to make a fair tax structure so that people like Melinda Gates or our governor will pay more so that we can spend on education, we can spend on health care, we can spend on the things that working people need now more than ever before.
Exactly, because when we live in a community or even in an era where people say, you know what, I want you to educate yourself. I want you to really go out here and I want you to eat better. But when I go in the store and you charge me $2 for a banana and I live in Inglewood, but I can pay 25 cents for a bag of chips, and I know that I'm going from paycheck to paycheck, I'm going to eat what I can, you know, and don't even start about a single parent. Because then now I'm trying to pay for a copay to make sure that I have somewhere safe for my children to be watched, you know, so that I can get to work. So it's like you're taxing me here, you're taxing me there, and it feels like I'm not ever making any headway, you know, but you have someone who can actually afford to pay a little more and they're not wanting to. It's like, well, why? You know, but like I said, JB took ownership to say, you know what, we need to change this. You know, people want to change what's happening in their communities. Let's make Chicago a place people can live in and not have to be pushed out of because we can't afford to live here.
Yeah, that's right. And I think you said it well, you know, Greg, like, you know, the reality is that this current problem is man-made, so we can fix it, right? And this is definitely an attempt to do it. Let's talk a little bit about what a fair tax would do with our nursing home members, because I think it's really important that we let all of our members know like how this impacts it, because like we hear the same problems over and over, but now we got to get ready to address like how these problems can get addressed. So I just want to share a little statistic. So for our nursing home members out there who are, you know, over 10,000 nursing home members in our union, right? If you can imagine, right, if we have funding for safe staffing, that will allow for every CNA in the state of Illinois to have 1 to 5 resident ratio at all times. And our nursing home members will tell you today, like that ratio right now is more than 5, right? We've heard stories where a nursing home worker has about 30 patients, right, in one shift. And this is ridiculous. And so, you know, this is what we're talking about. It's about bringing equity, but also about stabilizing services so that way a worker's not overworked, not underpaid, and that a patient or a consumer is not, their health is not put in jeopardy.
Yeah, that, like, I want to, 1 to 5, like, that's a nursing home. And people try to have this bad, you know, image of nursing homes, but don't realize that these people come to work every day and care for your loved ones, and they're doing the best they can. They're doing the best they can because these are people who no longer can live in their homes independently, you know? But when I've got 30 people, there's no way I can exhibit good care because I'm trying to decide now who to give care to and who not to. It shouldn't be that way, and it shouldn't be that way in hospitals, you know? But it's happening, and it's been going on, and it's like, it's one of those things that they say, let's bust the myth. You know, let's change what's happening. And that's another thing. Like, I'm glad about SEIU because they help us do that, you know. And then the fact that we helped elect a governor that now has taken ownership to say that he's going to do something about it, that goes back to how we educate our own members, how we realize that our votes do count.
They do.
You know,
Every single one.
Yes.
One of the things I would say and remind folks all the time, people think of hospitals and nursing homes and to a lesser extent home care and child care, and they think of them sort of as private things, and, but they rely very heavily on public dollars.
Yes.
Medicaid funding, even Medicare funding is very much tied in to what how you fund those industries, and so it's important that we have a government that can actually fund them.
Yeah.
And the way, unfortunately, that governments are funded is through taxes. And so again, I just always remind people, no one likes to pay taxes, but it's taxes that fund our entire system of government.
Yeah, because when you think about like managed care,
Yeah.
you know, and how they look at safety net hospitals, and what they'll do is they'll say, oh, you submitted this wrong when it comes to billing, so we're just not going to pay you for that service. The service has already been provided.
Yep.
The people are taken care of, but then you choose not to pay them, to reimburse them the funding that they actually are entitled to, and then you wonder why our safety net hospitals are in the red. And then you want to say you want to close them.
Yeah.
Like there's
Right.
something wrong with the services that they're giving, when in all actuality,
It's the fund.
It's the
it's the
system.
system.
Yeah.
You know, you talk about managed care, you talk about the Illinois Hospital Association, they're doing this intentionally.
Again, I would thank you all as we get ready to close this. This has been fun. I want to thank everybody who tuned in. This was our first stab at doing a Facebook Live. Hopefully it's been insightful and that you've learned a few things, and we'll get even better at doing them next time. But I would just call your attention again to our website if you want more information about our fair tax or the fair tax plan. It's SEIUHCIL.org/fair tax, FAIRTAX. Please go there if you want more information, and you can also go there to RSVP for the rally on April the 30th in Springfield. So thank you everybody for tuning in. Thank you Jackie
That's
and
right.
Kim
Thank everyone.
for the conversation.
Thank you.
And we'll see you all down the road. Thank you.
Yeah, and come out on the 30th.
Yes.
We need people there.
That's right. Have a good night.
Good night, everybody.